HIV is an enormous problem throughout the world. There are tens of millions of people chronically infected. Many, perhaps most of them, don't have access to current types of therapy. For every person we can put on antiviral therapy, more than one person gets infected. There's a huge global burden. The way to change the impact of HIV is to eradicate it. Prevention is a huge part of that. The effort to develop a vaccine will be incredibly important in this. And then the other arm is to cure the disease. I'm Keith Jerome. I'm an associate member in the Vaccine and Infectious Disease Division here at the Fred Hutch.
My name is Hans-Peter Kiem. I'm at the Fred Hutchinson Cancer Research Center, an oncologist and a researcher.
The Berlin patient was a watershed moment for the concept of HIV cure. People just didn't think it was something that was going to be possible. What the Berlin patient showed us was, in fact, it is possible. This is a person who had HIV for years and was very sick from it.
He had HIV and then developed leukemia.
He was cured through a bone marrow transplant.
And then the cells engrafted, and almost miraculously, he's now cured from leukemia and HIV.
And as you probably know, the whole science of bone marrow transplantation was developed here at the Fred Hutchinson by Don Thomas, who won the Nobel Prize for that.
So that would catalyze an entire field now. Now we had the first patient at that time that was cured.
This project is something that's so much bigger than any one person. It really takes a team. Defeat HIV is a consortium of investigators that was funded by NIH and is centered here at the Fred Hutchinson Cancer Research Center, devoted completely to the cure of HIV. It's led by myself and my colleague Hans-Peter Kiem. The other wonderful thing about Defeat HIV is the partners that we have outside the Fred Hutchinson. We have partners at the University of Washington, at Seattle Children's Hospital, City of Hope in California, from Sangamo Biosciences, National Institutes of Health. And because of the team we've been able to assemble, progress has been much more rapid than any one lab ever could have hoped to do.
It's actually wonderful because we can really take what we've developed in the laboratory, we can take that bench work to the clinic and really see how our work can help patients.
I'm very confident that we're going to find a cure for HIV. I hope it's soon. It can't come too soon for any of us working in the field, and clearly for people who've been infected with the virus and affected by the virus, it can't come too soon.